Thank you, Mr. Speaker. I yield myself 4 minutes.
The gentleman is recognized for 4 minutes.
Thank you, Mr. Speaker. I hope the tenor and substance of the debate we have in this House over the next few days will be worthy of the American people and reflect well on this Congress. Many of us believe we should focus our efforts here today on measures to help people put back to work, rather than on a bill that takes away important patient and consumer protections. And we don't think it makes a whole lot of sense to debate a bill that thankfully will go nowhere in the Senate and would certainly be vetoed by the President. However, the Republican majority is entitled to use its time here as it chooses, and while we believe we should be doing that focused on jobs, perhaps this debate will clear up many of the myths and misinformation about the health care law that was signed by President Obama. I'm interested to hear my colleagues say that they can identify with all the problems in the health care system. Between the year 2000 and 2006, premiums in this country doubled, health insurance company profits quadrupled, and this Congress did nothing. Why not put your plan on the table first so everybody can see it before you begin taking away the important patient protections in this bill, taking effect just since last March? And within that 9-month period, that law has made an important and positive difference to millions of Americans. In fact, we wished our Republican colleagues would take a few days, maybe even just a few hours, to have congressional hearings to listen to those individuals and families. The new Republican majority said it wanted to listen to the American people, but it has not invited a single American outside this Congress to a hearing to testify on the repeal bill we are debating today. And as a result, we on the other side of the aisle have had to schedule an unofficial hearing. It's going on right now, not 100 yards from where we debate, in the Capitol Visitor Center. And I encourage all of you to drop by, because if you do, you're going to hear some stories. You're going to hear the stories from moms and dads of young people who tell you how they're relieved that their sons and daughters are no longer kicked off their insurance policies when they turn age 22 or graduate from college, and can now stay on their parents' insurance plan until the age of 26. As a result, if their 20-year-old child gets sick or hit by an automobile or another terrible accident, they can get care without the family going bankrupt. You will hear from moms and dads with kids who have cancer and asthma and diabetes or other pre-existing conditions, telling you they're relieved that finally insurance companies can't deny their children coverage because of pre-existing conditions. And you will hear from senior citizens who are unable to pay for the huge prescription costs of their bills. And then as of January 1st of this year, they're getting a 50% discount, and they can afford to pay for the medicines their doctors say they need. And you'll hear from small businesses, and the number of small businesses using the tax credit has exceeded everyone's expectation. You'll hear from those small businesses saying they can now afford to purchase affordable coverage for their employees, and as a result, hire more people. You would hear all that and more. That is why it is such a mistake. It's a historic mistake to take away these patient protections and throw these individuals back over to the whims and the many abuses of the insurance industry. There's no doubt that the insurance industry will be popping champagne bottles if the health care law was ever to be repealed. Let's put the interests of our constituents, patients, and consumers first in this debate.
Time has expired.
I yield myself an additional 30 seconds.
Gentleman is recognized.
And let's make sure that as we do this, we tackle the deficit and the debt. I listen to my colleague talk about the debts, but we all know that the independent, nonpartisan Congressional Budget Office, in a letter to Speaker Boehner dated January 6, 2011, indicated that repealing this bill will increase the deficit by over $200 billion over the first 10 years and by another $1.2 trillion over the second 10 years. Now, our colleagues have criticized those findings, but they're the same people who they applauded when the numbers came back their way. So, Mr. Speaker, I thank you, and I reserve the balance of my
Gentleman
time.
reserved.